let's start by simply asking, what are biomarkers and which cancer types most often have biomarkers?
Yes, so biomarkers is a broad term that basically it's a way to differentiate or identify different cancers based on subtypes, right? So in the past, we used to focus only on the site of origin of the cancer. So let's say breast cancer or lung cancer, or just based on location. But now we go deeper, right? So the first type of biomarkers that we start to look at are, biomarkers of different types of tissue that are within that tumor. So in the case, for example, of lung cancer, we have different biomarkers or stains that differentiate between what we call as adenocarcinoma versus squamous cell carcinoma, which had different, prognosis and different treatment options for them. And the same can be said, for example, in breast cancer, where we have biomarkers for hormone receptors, right? We have estrogen and progesterone very commonly, and we also have, for example, HER2, which is another biomarker on the surface of the tumor. And that makes a difference between being what we call triple positive, which has the three biomarkers, or triple negative when it has none, or just hormone positive, which is when it has either the progesterone and or estrogen receptors being positive. So it's basically anything that we as healthcare providers can look at under the microscope, or looking at the genetic makeup of the cancer itself, that can help us to differentiate in terms of either treatment or even sometimes identification and prognosis. So every single cancer has unique features, and that's what we say, like every cancer patient is unique, and every cancer of that patient is unique, sometimes to the cellular level. So sometimes even the cancer cells that comprise the tumor can be different from each other. And for us to identify the biomarkers that are leading the growth, or their hallmarks of the cancer itself, is essential for us to make decisions in the right way.
Okay, understood. Yeah, it's interesting that cancer identification has kind of become so advanced that we can identify some of these specific biomarkers.